When Rogers started getting into the outcomes end of things in, about 2005, 2007, they were actually looking for interns that hand entered data for our outcome measures into an Excel file. So I was in my undergrad. At the point of time, Rogers had a building called the North Cottage that at that point wasn't in the best shape possible. And I was in the basement of this North Cottage, literally typing in patients' outcome measures into an Excel sheet. As I graduated from my undergrad, I moved into a role as being an outcome specialist and a residential counselor at the Eating Disorder Centers. I worked out a deal where part of my FTE was still entering in data, doing baseline statistical analysis, and then I was able to provide patient care, being a residential counselor at the Eating Disorder Center. And actually started working with Dr. Riemann and became a behavior specialist. So I was one of the first behavior specialist pools in the organization, and I was able to float to all of our different residential programs that were utilizing behavior specialists at the time, and our partial programs as well too. So it provided me this very neat opportunity where I was learning what our processes are for providing care, the same ones that we see today. Got to work with patients, all while kind of keeping that data side, that data end of things to it all. And then as I went back to graduate school, all that experience just augmented my skill set that I have today, becoming a director of clinical effectiveness and then having quality, and then now in continuous improvement. I actually ended up leaving Rogers for a short period of time and working for a major Fortune 500 company where I was able to go all over the United States and look at how care was delivered at very prestigious names and working on the data analytics side. And when the opportunity presented itself to come back to Rogers, I realized how good of a place it actually was at the end of the day, that the mission is there, that people are really there for the quality of care delivered, for getting our patients better, for providing charitable giving to our patients. It's a special place. If you look at the people I get to work with on a daily basis, pretty much all of them rose the ranks from intake and admission to residential counselors. They're expanding their skill sets in totally different ways. Rogers really does encourage people to grow in that sense.